dull when I was going live. But my dad's replaced the bulb. That shows you where my head's been. Not been in a great place, has it? But going back to these multivitamins here, guys. Right, daily recommended thing is one a day, yeah. But when we're talking multivitamins, we probably 75% of the vitamin that we've taken in our body. So depending on how we're feeling, we're taking 2 to 3 a day. Now, I'm not recommending you do that, but we're just trial and error. This one, these gummies, 9 vitamins it's saying you get. So you get vitamin A, vitamin D, vitamin E, pathogenic acid, which I don't know what that is, vitamin B6, folic acid, which is great for you women as well in pregnancy, vitamin B12, that a lot of people are deficient in vitamin B12, biotin, not too sure, vitamin C, and iodine. So yeah, it's quite a good one. And the thing is, they're quite addictive because they actually taste like a sweet. So at the moment, I'm trying to cure my sweet tooth. So I don't, overindulging in 2 or 3 of these. It's not so bad after all. What's the worst that's going to happen? I'm going to weigh it all out. But yeah, it means they're a bit more expensive because I'm having 2 or 3 a day. This is what I wanted to say as well. My stomach, I've been eating a lot of fried food lately, like fried eggs. I used to be on a boiled egg diet and that, but obviously it's just long-winded boiled eggs. So I've been more on a fried diet, and I think I've been eating that much. It set my stomach off a bit, where it just gurgitates, if that's the word for it, or makes that rumble. And I played it a bit safe because I went back to eating fried eggs again, and the minute I ate this stuff, my stomach went off again. So today I kept it quite light, and I just had a nice jacket potato with a little bit of cheese on, a bit of sprinkled pepper, and I feel okay after it. So I think I need to change the diet. Like I say, you shouldn't be eating fried food all the time. One, you're cooking in dangerous oils, cancerous oils. Yeah, so you shouldn't fry your food if you can cook it out other ways. So what else is it to report? I had a bit of a bad sleep 2 days ago. I don't know what it was, but I kept waking up for a wee here and there, and this was like every 20-30 minutes. So last night I had a little bit better of sleep, and I think it's because I took the 70ml. I think the 60 doesn't cut it for me. 60ml amitriptyline now, it is like a sedation. It does sedate me a little bit, where if I put something on my phone and I watch something, I feel myself getting tired and I fall asleep, but then it don't take a lot to wake me up. Now the 70ml does the opposite, so I'll have less episodes of waking up in the night. But the only downfall to having 70mg, if I don't take it now, which is about nearly 9:15 in the UK, and I leave it to about 11:30, 12 o'clock, it really leaves me groggy to the point I just feel tired all day long. So it's one of them. I've got my new medication as well today, so that's good. I'm from Manchester, Kumar Kamikara. Now he said, yo, what's up, Taboo? Dinky do. So yeah, nothing really to report. You know me, I just come on every now and then, say hello to you guys, hopefully get a few more subscribers. But yeah, what's everybody been doing this weekend? You got any plans for Easter weekend? I'm getting a neck tattoo soon. It should have been the 18th, but I got a message today telling me that the date wasn't the 18th that I picked, so it's been moved forward. So I'll get in about a week, and I'm looking forward to getting this tattoo. So what's everybody doing? Like I say, you got Taboo, who wants me to give him shout outs. I've got my nebulizer by the ready. I really need to wash this, but I've been lazy with it. Look at that artillery, look at the machinery on that Rambo. But yeah, I shouldn't really be using it through here, but it's been working a lot better through this mouthpiece and this device. Obviously the nebulizer is normally a mask, which I've got somewhere, in one of my brown bags, because they give me a couple of mouthpieces and they give me a couple of nebulizing masks. But this is so much better. You got the ease of putting it on. You can take it off. You don't even need to put that round your head, so to speak. You could just hold it and take it off, because I know a lot of people are like claustrophobic with it. My mum in particular, she will not have it for long amounts of time on the face, and when she starts coughing, she starts panicking. But it's designed to make you cough, so I understand that, you start panicking, but you've got to roll with the punches. If everything was easy, everyone would be doing it. People would be doing the treatment plans. People would go out and be a multi-millionaire if it was that easy. So you just lose the will, especially my mum. My mum's getting older now and this and that, and she tells me everything it isn't, and just to keep the peace, I'm like, okay. I'm at the point where I'm like, okay, mum, you know best. I've just got a channel with 357 subscribers about lung conditions. I've been hospitalised many times. I'm under IV therapy every 3 months. You know best. Yeah, when someone tells you an inhaler is better than a nebulizer, you know best. That's where I'm at. There's no point going into your psyche and proving people wrong. It's better just to let them live whatever thought or delusion that they want to live. Because there's no point being misunderstood. There's no point being misunderstood, I think we need to change my name now to Professor Bronchiectasis Musco. No, I'm only joking. So yeah, I've got to keep it short and sweet. I've got somewhere to be tomorrow, so we're going to enjoy that. My son's come for the weekend, but he's been bloody sleeping half the bloody day, so we'll spend a bit more time tomorrow when he's more lively, and I am, because I shut down at this time. I go into my little element now where I just chill out, take my tablets, do what I'm doing. If I'm not so tired, I'll go back down, I'll see the family, I'll speak a bit, and then I try to unwind. I've been great till this point. Last night was my only late night in about a week. I'd been, going to sleep about 9:30, 10. Last night, probably about 11:30, 12 o'clock. And I felt worse for it. Don't know if them extra 2 hours, I was getting was benefiting me, or I was taking my tablets too late. Another thing, I've not just been able to jump out of bed, where a few days ago I'll be able to just get up and this and that. I've just been lying down and just reading my body, my stress, and am I ready to get up, am I ready to do things, and that's not like me. I'm one of them who gets up and does things, even if I feel like crap, do something. But I've been reading the body a lot better these days, and I think it's benefiting me in the long run. So yeah, we can all grow wiser, stronger. Yeah, and that's about it. Right, I'm going to love you guys. I'm probably going to leave you. Like I say, there's one thing I've missed off. I put in my order for my gentamicin, because they're due, so that went in. Picked up my other medications today. I always get nervous about my amitriptyline, so normally I order it a week, before it's due. That way they can't mess me about, because now I've been on this tablet amitriptyline for a good 2 years, maybe 3, and I can't sleep without it now. So it sets my anxiety off a bit more, knowing that I've only got like about 270 mils left, if that makes sense. So it starts making me a bit panicky. But since I've knuckled down with the chemist now and knuckled down with the surgery, so I'll say I don't need my full prescription now, because I've got some spares of this and that, but you can't leave me without my amitriptyline. Since that, everything's runs pretty smooth, which, I'm quite happy. I've got my doctors on the road next to the chemist, so it won't take me long to get something sorted in this day and age. But there was a time when I was under a different pharmacy, and they were messing about with my meds and things like that. Delivery, I actually went a week a week without amitriptyline, and I started showing huge withdrawal symptoms. Went pale, blood pressure went down or high, can't remember, lots of things. And I was on treatment at the time for my chest, and the nurse said, you need to get that amitriptyline, you're having drug withdrawals. So, you know, just be careful, especially if you're on anything to do with your mental health in particular. You don't want to have drug withdrawals, anything for pain. So the amitriptyline is to stop my IBS pains, and also like a sleeping aid on top of that. Obviously the pains keep me up at night, and it seems to be a lot worse at night time as well. I don't know if that's because I'm lying down or I'm thinking more or whatever. So it's like a 3-in-1, because they used to use amitriptyline for antidepressant tablet. They use it for the pain, nerve ending pain, and sleeping tablet, bit like that. So it's a 3-in-1. You can call it a 3-in-1, and I think it works wonders. I think that they should use it more in mental health. I really do, especially when you're talking about depression, anxiety, and lack of sleep. I think they're shooting people up with too many drugs, high doses of it, making them a bit too zombified, shooting depot in their arse cheeks, you know, with no resolve. And just because this amitriptyline is an old medication for mental health, it doesn't mean because these other medications have come on that this is no good. It's the same way as treating water infections or things like that. Now they give you 3 days of nitrothiazide or something like that, which is very toxic to the body. And believe me, if you're on that stuff for a water infection, you want to be guzzling down a hell of a lot of water, and you want to be flushing it out. And if you can sweat it out as well, you want to be sweating it out your pores. They used to use something called trimethoprim. They use it a lot for people with prostate infections in particular, and that used to be given for men for UTIs, because you don't see a lot of UTIs in men because the urethra is longer than it is in a woman, things like that. So it's very unlikely you're going to get water infections, but you can still get problems there because we have a prostate gland. So I hope that clears everything up. I'm going to educate your ass in anything, and if someone says you know it all, say thank you very much, that's why you come along. See you later, guys. Take care.